المريض ده كان فعلا ما بين الحياة والموت.
These lungs were not going to last a long time.
Although we know it's going to be a complex surgery,
where there's very high risk of actually dying just from getting the anesthesia.
We were worried that at various stages the heart might fail. The lungs were so bad that he was struggling.
I have a donor.
مرض ضغط الشريان الرئوي مرض نادر ويصيب الناس في سن مبكر.
Justin was maybe one of the most complex surgeries. How urgent the patient needs a lung transplant.
كنا حاطين له كمان اكسجين بيشتغل معاه 24 ساعة.
It's always on my mind when I'm going to wake up the next morning. Inhale, exhale. That's a constant fear for me, whether it's going to be my last breath, especially when I'm sleeping at night. And I think that's the constant fear that every pulmonary patient goes through.
Justin had an end-stage lung disease. He had a rare disorder that called pulmonary hypertension. And actually this is one of the disorders for which patients may have a very advanced lung disease after a while.
المرض ده على فكرة شديد جدا وبيأثر على حياة المريض وقدرته حتى على التعايش بشكل طبيعي. فهو المريض هو شاب صغير مدرس رياضيات ففقد القدرة على التدريس لأنه لما يكون عندك انخفاض في الأكسجين شديد حتى الكلام بيكون صعب.
Pulmonary hypertension basically limits everything that you can do. It starts at one, basically starts off small and then just makes you do less and less and less.
And it becomes very difficult for air to go into the lungs because they cannot expand. So this is a type of disease that is also called fibrotic lung disease. And because of that, the heart also starts to get affected. The right side of our hearts pumps blood into the lungs. If the lungs become very difficult and very stiff for air and blood to go in, then the heart starts to get affected.
But over the time, we realized how much oxygen requirement he's having. He started to have more trouble breathing and very specific condition with what we call the pulmonary hypertension when it starts affecting the heart.
هو طبعا الزراعة جزء أساسي من أي مركز يتعامل مع ضغط الشريان الرئوي زي ما قلنا لأنه إحنا لو سيبنا الموضوع يتطور مش بس الرئتين تلفانة كمان إحنا سيبنا الموضوع البطين الأيمن والقلب نفسه بيتلف فبيضطر المريض يتحول لزراعة رئتين وكمان قلب ودي أصعب وأصعب ونادرة جدا.
Mainly the right side of the heart where it starts struggling to pump and other lung or other organs other than the lung itself starts to be affected like the kidney, like the liver.
Even with the medical therapy, these lungs were not going to last a long time.
Are you able to do any walking at all? No.
Very
little.
Yeah.
And have you basically stopped working for about a year now? Okay. And in addition to the pump, medication and the pump, you're also using oxygen pretty much all the time, 24/7.
Yeah.
And for most people, this results in severe debilitation and sometimes end of life. And in these situations, when appropriate, lung transplant is really the only treatment that can provide the person with the ability to breathe again and to live some mostly normal life.
every day was a fighting day for me, and every new day that I saw, I was grateful for, because sleeping at night or not sleeping, which was most of the time, it's always on my mind whether I'm going to wake up the next morning.
And Mr. Justin's number said that he needs to have a double lung transplant within 6 months. So you can imagine how important to keep somebody alive and at the same time sick in order to go for this kind of complex and difficult surgeries. Almost over a period of 6 months, we had a very extensive workup with him. We looked at the heart, the lungs, the other body organs, and we started to prepare him to be listed for a double lung transplant.
وفيما يخص التبرع بعد الوفاة، فإن هذا البرنامج موجود من 2017 إلى الآن. تم تمكين أكثر من 111 عائلة من ممارسة الحق في التبرع وإنقاذ حياة الآخرين.
When Justin was brought into the hospital for transplant, he was using 6 liters of oxygen. He was barely able to get out of his bed and go to the bathroom. His other organs, his abdomen was very swollen and distended. The right side of his heart was massive because of the high pressure in the lungs.
Here at Cleveland Clinic Abu Dhabi, we work together to understand when it's time for somebody to be referred and at the same time when it needs to be listed. And this is exactly what we did for Justin.
We have some updates from the National Organ Donation Program that there is a potential suitable donor, a 47-year-old male, that we hope after our full review together that we can decide if this is the right donor for Justin. And as was highlighted, he's been a teacher all of his life and he wants to go back to his life, go back to his students, and so I hope this can be sorted out.
فجاستن كان بحاجة إلى زراعة رئتين لإعطائه يعني أمل في الحياة.
Mr. Justin, this is Dr. Fadi calling from Cleveland Clinic Abu Dhabi. How are you?
I'm sorry, I'm good, and you? How's things going?
Well, I'm here with Dr. Hani and Dr. Usman, and I think we have great news. You know, as we told you a few months ago, we were waiting for a matching donor, and then we have a great donor that matched you actually, and then we're calling you to give you the great news that we will want to proceed with the double lung transplant surgery as we discussed before, and actually have Dr. Usman in here that he can tell you in a minute what he's going to do, but this is great news.
I don't know what to say. I have no words.
And you know, we talked with him in a meeting. We gave him the good news to say, we're ready for tomorrow. We want you to come in the morning to be, assessed again, just in a very short period of time, to be transplanted tomorrow morning.
The surgical team looking at the lungs ourselves, we want to make sure that we get the best possible organs for you. And we think we have them, but we're going to bring you in, get you prepared for the transplant, and then look at the organs. And if everything looks good, then we'll proceed with your transplant.
I don't know, man. I just want to say thank you for everybody that stood by me, continuously motivated me and gave me hope. And thank you for caring for me. And I'm actually looking forward to this because I know I've been in good hands already and I know I'm in the best hands. So thank you very much. When I received the call, I just froze. I didn't know what to do. I was sitting on my bed. I was alone at home. My wife wasn't there, and I didn't know what to. I didn't know whether to call her because she's also been through a lot, and
So this was a difficult operation. These operations are very challenging no matter who's doing it and no matter where it's being done. And that's why it's critically important to have the right expertise all the time.
ودي طبعا عملية جراحية معقدة بتاخد ساعات، وفي قسم طبعا تخدير الزراعات تخدير معقد جدا، لأن انت بتخدر مريض اوريدي مريض جدا وحالته يمكن ما تستحملش التخدير العادي.
As an anesthesiologist, I have to make sure that the body continues to receive oxygen during these stages without the major organs suffering any damage.
We have performed a couple of lung transplants. Actually, Mr. Justin was maybe one of the most complex surgeries that we have had based on his pre-lung surgery itself and his condition.
The first thing that came to my mind is like my donor. I'm taking somebody else's lungs. I was speechless and I didn't know what to say. And she grabbed me and I told her, I have a donor. And she also didn't know what to do. It's just unbelievable, actually. And up to now, I still, I can't believe it. It's amazing.
Particular time when the heart, because it was failing, was so large that the surgeon was finding it hard to operate with the lungs because the heart was coming in his way. So we decided to place Justin on the heart-lung machine and decompress the heart, which makes the size of the heart smaller so that Dr. Usman could operate freely on the lungs.
Let's have the left lung up, please.
Okay.
Start ventilating the left lung.
Left lung is up.
Okay, let's open the lungs, please. I need the right donor lung first. Both lungs look good. Good ventilation. Perfusion looks good. How's the graft function?
Numbers are good. Lactate is fine. Blood pressure is stable on the same support as before.
How's the cardiac output?
Cardiac output is fine, 5 liters with an index of 2.2.
Great. How's the urine output?
Urine output is good. It's been passing about 40 to 50 mL an hour.
So I think we should be able to, after implantation, we should be able to wean cardiopulmonary bypass.
Yes, we should be able to.
Through around 8-hour surgery in a complex, with highly qualified surgeon, anesthesiologist, a background of a lot of trained, people in the OR. After 8 hours, although we know it's going to be a complex surgery, but this is exactly what we do in here.
And this is where multiple experts in all the treating teams have to come together to take care of these really difficult problems.
Just within a few days of the surgery, the lungs are back to normal and the heart is back to normal, and now he has a new chance to live like any other patients.
It was very difficult at first, very painful, but it's amazing. It's something else. I've been given my second chance in life. I can't describe it.
Hey, Justin. Hey, how are you? Okay, well, let me give you the good news. All well, all done. The surgery went well. After 8 hours, right now, you have a brand new 2 lungs. So whatever was in the past is over. Remember, you were sick with a lot of oxygen needs, from your lung disease. Successfully, the surgery went very well. Things were good, and actually you have new lungs. I can tell you over the next few days, things will recover quickly. You would not even need oxygen anymore. You'll be able to go back, function normally, go back to your normal lifestyle. I know you had a rough period of time the last few years, but right now, after this successful surgery, brand new life, brand new lungs.
This double lung transplant has given me a second chance in life and a whole new perception. I've learned to appreciate things more, and it's the simple things in life that matter now.
ونقدر نقول بشكل قاطع انه الحمد لله بفضل ربنا ومجهودات كل الناس انه هو كتب له عمر جديد حقيقي وعمر جديد من غير المرض يكون فيه.
To all pulmonary hypertension patients out there, I would like to encourage you to keep on persevering, keep on praying, keep the faith, never give up, because miracles do happen, and I am proof of that. How are you doing, man?
I'm doing great. How are you?
I'm good. It's been a while.
That's right. So this is the mouthpiece.
Yeah.
What you're going to do is you're going to keep it inside the mouth. And close your nose with this nose clip.
So I encourage people to go out there, become donors. My family, majority of my family have become donors now, and it does save lives out there.
These things are always a big challenge, and these things are always miracles. We're very thankful to the people who donate organs because they save multiple lives.
Donation always saves lives, and you can always bring a patient back to his family, to be alive and to be able to function and to be an active member of the community.
Imagine feeling that all the time, where you cannot get enough air and enough oxygen, and that is a very difficult feeling. And when someone is at that stage of lung failure, and then all of a sudden they go to breathing normally, this is a massive relief for them. This is return to normal quality, normal life, and this is a massive success for the patient and for us as his physicians.
Keeping in mind that even in a moment of grief or tragedy such as death, your preparation to donate can bring happiness to other families and other members of your community and the country.
التبرع زراعة الأعضاء يعتبر رمز مضيء للتآخي الإنساني، وهي تعزز ثقافة التسامح والتكامل بين أفراد المجتمع. فهذا التبرع فعلا يعني مبدأ إنساني، ودولة الإمارات البرنامج هذا اللي احنا فيه يمكن الكثيرين قد ما يعرف أن المتبرعين والمتلقين ينتمون إلى أكثر من 48 جنسية.
Pull me through from the beginning to the end, from the time I came out of ICU till the time I started drinking and swallowing again. Every time I saw my wife, I just got better and better and better. And she's been the most encouragement for me, and yeah, she's been the strongest part in my life. And I'd like to thank her for it, because I wouldn't have got this far without her. And I'm truly blessed to have her in my life. Today I'm sharing my story to tell every pulmonary hypertension patient to keep on persevering and to never give up no matter how difficult it gets. Keep the faith, keep praying, and always maintain the hope.